And we'll just do some introductions now. So apologies that we're a couple of minutes late starting. It's my pleasure to welcome you to the Support Unit Methods Cluster webinar, specifically on patient engagement. My name's Sterling Bryan. I'm the Scientific Director here of the Support Unit, and the webinar is going to be led by Dr. Erin, who is our Patient Engagement Methods Cluster Lead, and also contributing will be Alison Holmes, who is our Methods Cluster Knowledge Translation Specialist. So before we start, I would just like to acknowledge that the webinar is taking place here from the Support Unit, which is within the ancestral, traditional, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So we're delighted to be delivering this webinar today, and I'm going to hand straight over to Erin. So thank you very much.
Thank you, everybody, for your patience with our gremlins this afternoon. It's really a real pleasure to be here. We're going to dive straight in so we can get through our content and meet our objectives for the webinar today, which are to provide an update on the patient engagement methods cluster projects currently being developed, and to really have a good chat about emerging opportunities for engagement within the context of the BC Support Unit. So just to recap briefly, first of all, on the process that we've been through since November of 2017 in terms of coming here today to share the emerging projects that are occurring through the Patient Engagement Methods Cluster. Many of you will be familiar by this point with the fact that we've gone through a fairly fulsome engagement and consultation process. This began with an online survey back in November before the visioning meeting, which 60 or so people completed. We then conducted a series of interviews and focus groups, which led up to the visioning workshop, which we held in Vancouver in February of 2018, which was attended by 51 stakeholders wearing various hats, as well as using digital and social media methods like a tweet chat, a follow-up webinar, and here we are today on the 24th of October to share both the overview of the results of that process with you and the next steps that we've taken in the interim in terms of actualizing them. Many of you will also remember as well that what we heard on the basis of the consultation process around our focus for supporting patient engagement and research through the Support Unit was really one very strong overarching theme, which we entitled Advancing and Embracing Diversity in Patient Engagement in Research in BC. There was a very strong message that we heard from the consultation process and from those stakeholder interviews and consultations, that one of the things that we really cared at our very core about was engaging in a different and more effective way with people who are facing multiple barriers to getting involved in research in British Columbia. Nested with under that overarching theme were three different sub-areas, which I'll come to in a second. But one of the things I wanted to touch base on first before we got there, and thank you to the person who actually sent us a tweet about this last night, was how are we unpacking and interpreting this term diversity in the context of patient engagement and research? And this is what we heard on that, and this is by no means an exclusive list, but on the basis of those stakeholder consultations, we heard that it's really important for us to look purposefully at making sure that our research is involving people of diverse genders, for example, trans people are identifying as transgender or gender diverse, members of the LGBTQ communities, Indigenous First Nations communities, those people living in British Columbia in rural or remote or harder to access areas geographically, people across the age spectrum, so those who are younger or older, ethnic, minority, immigrant, or racialized populations, people who are facing systemic level barriers in terms of poverty, low socioeconomic status, or financial barriers that might impede authentic engagement in research, and people who are acutely ill or experiencing complex illness course. So, for example, comorbid diagnoses or conditions, which basically means experiencing two or more conditions at any given time. As I said, this list isn't exhaustive, but it's a starting point in terms of beginning to stretch our thinking around what we mean by the term diversity. And I think, broadly speaking, we're talking about people who are facing potentially multiple intersecting barriers or stigmatized identities or conditions or inequities or forms of oppression that can impede engagement in the research process. The other thing that I wanted to touch base on as well at this point, beyond this, were the conversations that we kind of had and heard around some of the values that are underpinning this work. And I really see these values as kind of the tether, the ground or the platform for the work of the patient engagement research cluster. And these broadly were speaking around the importance of taking an intersectionality lens. So intersectionality at a basic level really acknowledges the interconnections and overlap that occurs in systems of discrimination or inequity. Put more simply, we wear multiple hats or recognize various identities at any given point of time, and these intersect in terms of ways that we can interact fully. We also appreciate the idea and acknowledge the importance of a health equity lens and really driving towards less health inequity and greater health equity. And then this term that I've used for the purposes of this process or today's talk of an even playing field. Other people couch this in different descriptions. So, for example, thinking about power redistribution in terms of engagement with research. But I think the most common thing, the way of phrasing this that we heard was that what we're striving for is creating spaces for people, different stakeholders with different identities and different types of expertise, come together in a space where we can all contribute different types of knowledge in a way where power is redistributed around that process, where one type of expertise or knowledge is not privileged over another. One of the other core values that we heard very strongly was around the importance of authentically co-creating advanced methods for patient engagement and research in Indigenous communities, and really honoring traditional ways of knowing as part of our work. And then finally, the one I wanted to touch base on in terms of values was, this is more emergent and more recent, but it's around the idea of kind of moving the dial in terms of diversity. So I think by moving the dial, we were talking about the need to include more diverse voices and representatives in research in BC. But the other side of that coin, or the other important point of that, I think that we've heard repeatedly, is also not leaving behind the voices and stakeholders who have really, people who began to move the dial in the first place, right? The people who began the movement towards patient engagement in health and health research 20 years ago in British Columbia, and honoring that history and continuing to create spaces for more diverse voices, but also people who have historically shaped this movement locally and nationally. Okay, so going back to what we heard in terms of the priorities for the patient engagement methods cluster, there were 3 priority areas nested under that diversity umbrella. One is around patient priority setting. That's the last that we'll speak about today. Harnessing digital technologies and taking advantage of them, and methods for evaluation of recruitment and patient role optimization in research. So let's get a little bit deeper into that. And really the purpose for today is to talk about the different states of development and readiness of these various themes and different ways for you to engage if there's anything that really piques your interest in any of these areas. So let's talk about digital health technologies first of all. This is a really active area across the spectrum of the work that's happening in the BC Support Unit broadly, not just in the patient engagement methods cluster. There are several cross-cluster projects under development or already have been in the initial stages of have been initiated. Cross-cluster projects refer to those where they're being co-led by 2 or more of the clusters. So an example of that would be the Citizen Science Project, which is under the guidance of the Knowledge Translation and Implementation Science Cluster, as well as the DASHI cluster, which is the data science one, and the patient engagement cluster. So we're sharing responsibility across those clusters for moving the Citizen Science Project forward. And at a basic level, this is a very exciting project to develop an online portal for people to engage around the focus now is around the symptoms of health conditions that they're having, to share knowledge around what the lived experience of like that is, and to really drive new research questions and to drive the research agenda forward. So creating a new platform to build a large database in British Columbia, but also kind of a fertile testing ground for new ideas for research. And you can contact Alison Hoynes directly if that's something that you haven't had much details of yet or would like to learn more about or contribute to. There is another project which is being done through the Health Economics and Simulation Modeling cluster, primarily led by them, but also across a couple of the other clusters, which is looking at advanced use of videos for sharing health information and for kind of moving the dial around health economics and the ways in which healthcare is funded. So, of course, budgeting decisions in healthcare systems are very complicated and difficult decisions to make. And this HESM video project is really driving the science around promoting conversations about health economic issues through educational videos and testing the impact of those on patient level and system level outcomes. So that's those cross-cluster projects at a very high level. Let's get a little bit more into some depth about another project which we're talking about at this stage in terms of the Digital Divide project. This is an example of, I'll come back to that in a second. This is an example of one of the projects that's quite nascent, is quite early in development. Just to remind you that the process for picking projects and moving them forward through any of the clusters is that projects are developed into a project proposal. They then come to the Science Council for input. They then go out for external review and development on the basis of experts in the field. So there's kind of an iterative process of development that all of these projects go through. Some of the ones I'm telling you about today are right at the beginning of that process. They haven't been reviewed fully at the proposal stage. These are kind of germs of ideas that we're moving forward. And so in many ways, this is an ideal opportunity for you to engage with them if there's something that looks really interesting here for you. And this is an example such as that. So this is a project that was begun by a woman called Sandra Dawson, who was one of Canada's leaders in terms of suicide prevention. She had a project that she initiated in 2016 in collaboration with the Mental Health Commission of Canada, and it was designed as a knowledge translation project to address what we term as the digital divide. The digital divide is basically referring to issues and barriers that people face in terms of accessing online information, accessing the internet, and for the purposes of our cluster, for engaging in research online. Sadly, Sandra died earlier this month from cancer, and we're very keen to see this project, which was very well endorsed by the Mental Health Commission of Canada, went through a strong review process at that point. We're very keen to see the legacy of this project, to explore the legacy of this being moved forward through the BC Support Unit. And so we're currently looking for actual project leads, people to take her, to adapt and to kind of transform her initial project idea, but still kind of keeping hold of the values that she cared about perhaps, and to move it into more of a research rather than knowledge translation focused project somewhere in British Columbia across the breadth of our diverse geographical spread. So if you care about digital health, if you care about developing training modules so that people facing barriers to engagement and research online can do so more effectively, probably conducted within this context of some kind of a mental health commission, being as this is a project that would be partnered with the Mental Health Commission of Canada, get in touch with me directly or Alison and we can tell you more about that and further details about opportunities for engagement. Moving on into the video project realm, let's talk a little bit about the patient engagement video project, which is different from the one I told you earlier about to do with health economics. So this is another very early project idea, which we're just kind of getting to the stage of writing the research proposal for. The platform that we suggest using for this is something called Tapestry. This is a new platform which has been developed at UBC as part of a teaching and learning enhancement fund funding through the University of British Columbia. And it's really novel and pretty exciting. Let me tell you a little bit more about how the platform itself works. By the way, you can access, there's a bit of a lag when we run webinars in terms of live demoing websites. But if you look at that link on the bottom right-hand side of your screen right now, you can see live versions basically of all the stills of videos I'm going to show you over the next few slides. So feel free to go to that website and play around with it after this presentation. But I want to give you a visualization of how Tapestry as a base IT platform is a little bit different. It might allow us to do things differently through the BC support unit. So this is the way Tapestry works. This is a little demo video, which is on the website currently. It shows one of the developers, one of the artists on the project, and it just shows you the way in which there's a linear timeline through which Tapestry enables a video. Essentially, it's a video conversation. So imagine that the way that videos are usually constructed to share health information or research information, they're static, right? They're an immobile product that can't be changed. Tapestry is different in that it creates an online space for people to have conversations through content, essentially. And so what you can see on the bottom there is the thread, which is the basic kind of branch that happens through the platform. The really neat thing about this platform is that you can co-create content through it. So it's not that the teacher or the knowledge provider is saying this is the curriculum or using a kind of didactic model for teaching or sharing information. The learner or the student or the patient or the knowledge user or the decision maker can add content to that process. And the content can come in any form. It can be audio, it can be documents, it can be video. And so you can have as many branches as you can imagine coming off this base platform. The one that's being developed currently will actually look more like this than linear. It will be developed on nodes. And I'll come back to this image in a little bit later to talk about how this might look through the patient engagement methods cluster. But let me give you some quick examples of how we've been developing this for different products recently. So this is a module we've developed on intercultural understanding. You can see that the branches underneath talk about different theories of intercultural understanding and diversity and branch out into different levels of depth. This is describing some research that's actually happened in Cape Town, which is looking at segregation by race. And so what you see through these studies and through research is that people, when they go to clubs in Cape Town, actually still stay in fairly homogenous groups defined by race. So they kind of party together, but they still kind of party in segregated groups. I just wanted to show you this because what is a demonstration of how we use animation as part of Tapestry to share health information. And then we can do the same with theory, right? So there's some pretty dense theories which can be unpacked through this platform in a way that provides a different kind of knowledge translation or sharing of research. And this is the one that we've been producing on stigma. And you can see that we've been unpacking that stigma occurs at social levels, at the level of the self, and the level of public, at different levels of the branches below. Excuse me. And that's an example of how you can include any existing video content in the Tapestry platform itself. And this would be, if you went to this live section of the site, an audio clip by queer theorist Ellie Clare, which is a very powerful piece if you haven't heard it before. So just to come back to where we sit with the patient engagement methods cluster, you can imagine how the Tapestry platform could allow us to do all kinds of things in terms of testing out the impact of health information and providing new opportunities for people to engage in research. And so the way I envision this working is that we would develop an overarching module or branch around methods for patient engagement and research, and then sitting under that could be any number of individual nodes. And the way this should work would be that you, members of our community would identify potential areas to take leadership with. And the reason I really like this model of tapestry for what we're doing is that through this project, we can culture lots of individual and small group leadership in different areas. So it might be that, for example, within the PE cluster, we develop this overarching module on patient engagement, but under that, there could be an individual module on indigenous models of patient engagement that are showing efficacy in BC. And that particular module can be co-created by academic leads, Indigenous First Nation leads, where they co-create the content together. But that content isn't static, right? It changes over time. I don't want to eat up too much time with this, but feel free to contact me directly if there are any particular areas of that you have ideas for. Okay, I'm going to go back very briefly just to talk about this particular project, to touch base on it, which is advancing methods on the right-hand side of your screen, advancing methods for evaluation of recruitment and patient role optimization. This is a project that's a little bit further down the developmental timeline. By November, we'll have the first draft of a research module and proposal for this. We have 2 wonderful co-leads identified for the project, and they've asked us to share today that they're particularly interested in hearing from stakeholders in British Columbia who are already engaged in research in what they're terming hard-to-reach populations. So if you've been working previously with communities who are hard to reach through research, they would like to hear about your experiences, potentially connect with you. They're also actively looking for additional patient partners for this particular project. And so if this is an area that you really care about, thinking about not just recruitment, but retention of people in research and how to really help people flourish in their roles, this project might be just for you and is also really ripe for engagement right now. Okay, we're at about 12:30, so I'm going to go forward to talk a little bit around the patient priority setting topic. This is the point of the webinar where we would actually like for you to view a short presentation which was produced through the KTIS cluster previously. What we have to share with you at this point is a link. So you can see that on the bottom of this slide there. Because the streaming capability is not always brilliant in a webinar, it's going to be better for you to open that link in a separate video. It's about 6 minutes long. We'll watch it separately here within the BC Support Unit offices, and then we'll come back around for a discussion and open the line for about 20 minutes of discussion about this particular project and other projects that I presented to you very quickly. I'm sorry, I needed to make up time there, so I'm sorry about the pace of that. But what you need to do now is either copy that link into another window, watch the video, which is a separate YouTube clip, and come back and join us again in 7 minutes. We're also going to put it in the chat section of I think in the chat box to the right of the webinar system as well, so you should be able to take it right from there.
If you have any questions in regards to process of how to link that, please feel free to enter in the chat box any questions, any technical questions, and we'll try to address them for you.
Okay, welcome back. I hope that little kind of technological segue worked okay for everybody who's on the line. And I'm hoping that that short video excerpt will have given you a good kind of overview of the directions that Dr. Heather Gameforth and Nellie Olkey are going in terms of the knowledge translation and implementation science project around priority setting. Nellie happily is on the line today, I believe, and so it would be great to be able to open the conversation and to have a chat about possible projects in the patient engagement methods cluster stream that would really kind of complement or build on that important and exciting work that's happening through another cluster. So I can see lots of opportunities for synergy there personally, but I think at this point it's really time for us to open this discussion out and to hear about project ideas specifically focusing on the patient priority setting area, but we can also backtrack to some of the other projects that I introduced earlier in the webinar as well. So over to you guys for questions.
So I see there's a question from Kimberly in our chat box that says, I'm curious if there's a spot on your website that lists all the current opportunities for patient partners to participate in various projects, or if the opportunities will be posted on Patient Voices Network. Excellent question, Kimberly. The focus of the webinar today is related to the methods clusters. And each methods cluster has done webinars in June for the projects that are moving forward with the names of the project leads, the people who are leading each of the projects. So you're welcome to go to the web page for each methods cluster project and view the recording and see if there's a particular interest in any one of the projects to engage with, and feel free to contact me. In regards to all projects happening in BC that that there's potential for patient engagement, there's no centrally one source for that. There is, of course, Patient Voices Network. We do also at the support unit have in the newsletter announcements for patient engagement in projects. Does anybody else around the table have anything to add for that?
I mean, in some ways, it's a work in progress as well, because one of our demonstration projects is actually building a platform that will be a portal through which opportunities for patient engagement and health research would happen, and to complement and to work collaboratively with Patient Voices Network. The focus of that is also around patients as subjects in research as well. But it's not exclusively that. It's also about patient engagement as partners in health research. But that's something that's not happening just at the moment.
And I see there's a question from Fraser Health. For the project developing methods for recruiting and defining roles of diverse, hard-to-reach patients, you mentioned that experiences will be gathered from BC researchers and community partners. Has this project group considered reaching out to the patient engagement specialists in each of the BC support unit regional centres? They would be key people to interview. Excellent point. Thank you, Fraser Health. Yes, we're as Erin has described, these projects have not yet completed the process of internal review and external review. So we're early in the development of the project proposals, but the methods for how to identify teams throughout the province that are already engaging in patient-oriented research. We, of course, at the support unit have a listing of all the teams that we've supported. And that will be one avenue. but that is not complete, and thus the regional centers would be an excellent avenue to identify other teams to interview. Thank you for that point. Are there any additional questions? Perhaps in case people are typing, one of the other things that we're most interested in, we know that not everybody is able to attend at the same time that the webinar is in live process. So there'll be a number of people that will be watching this webinar in a time that's more convenient for them. And just because you weren't, if that's the case for yourself, just because you weren't able to attend live today, that doesn't preclude following up with either Erin or myself. And the last slide that you will see in the slide presentation has our email addresses. They're also available on the web page for the Patient Engagement Methods Cluster. So if you need time to sort of digest, even if you're attending live and you want some time to digest and think about how you might be able to contribute, please do so, and feel free to reach us at any time. Erin likes to work till midnight, so there shouldn't be a problem.
So do you.
Yes.
And I just have a quick question. The project about developing methods for recruiting and defining roles, who is leading this project? I noticed it said Lower Mainland and Northern BC, so just curious.
Okay. Davina Banna and Sue Mills at this point are co-leading the development of that particular application. And they were the people that I was referring to that are actively looking for patient partners and really, communities of practice that have been working, of which there are actually many in British Columbia, right? One of the things we heard as part of the consultation process is that there are pockets of excellence in terms of, use the term you want, including people who are hard to reach or facing multiple barriers. And there is great expertise and knowledge already available in British Columbia. So part of their visioning for that project is to tap into that, to figure out what's been working in the context of BC, in particular with a diversity, intersectionality, health equity lens laid onto it, so that we can build on practices that are working, and also looking at gaps and opportunities, and as a consequence of that, the development of training materials that can really help us move forward more broadly at a provincial level in that area.
I see that there's a question from Carolyn. Is there a place where all the projects in development are cited? Please, can you advise how leadership was determined? Carolyn, thank you for your question. Yes, we have to be sensitive to posting on a public place projects that are still in development and haven't yet gone through internal and external review, and therefore the names and the details on those projects were not, it's probably not a good idea for us to have that in a hard copy or an electronic copy somewhere. So as far as that, no, we do not have these projects cited with detail on our webpage. However, we are sharing this information to the degree that is plausible to do so in the webinar today. In terms of how leadership was determined by opening up, as you know, through the stakeholder process, whether it was through interviews or tweet chat or the actual visioning event, or through the focus groups. Once those themes, that overall theme and those three sub-themes were developed, both through the distribution list of everybody who engaged through those stakeholder consultations, in addition to our support unit newsletter. So if you're not already on the support unit newsletter distribution list, you can sign up for that on our webpage. So we put calls out through the newsletter and through the email distribution list to ask people to say, please put your hands up if you're interested in either leading, collaborating on, or being kept informed of projects that would be in development with each of the methods cluster. It's not just the patient engagement one. So that's how leadership was determined. It was determined through how asking people to put their hands up to indicate if they wanted to contribute and to what degree, to lead, to collaborate, or to be kept informed of.
And the opportunities for leadership going forward?
Well, there are a number of, so I think one of the most important things to know about the way that the PE methods cluster work is rolling out is that it's rolling out sequentially in a staged process. And so what we're showing you today is a couple of the earlier projects that can be actualized and initiated over the next few months. So the video project, for example, with the different, I really see that as a great project to build leadership across multiple sites, and it's ripe for opportunity for leads to come forward at this point. The Sisters in Science project is another example. Well, actually, the leadership for that within the PE methods cluster and the individual pieces of work in the specific project will not come until 2019 because we've decided for that particular project and its timeline that makes more sense to build the platform, to have something functioning that's led through the data science and the knowledge translation clusters, and then for the PE methods cluster to come on at that point with more clearly articulated specific projects. And so there'll be another consultation project for Sisters in Science as one example in 2019. So in short, leadership opportunities are rolling. There are many of them. And I think the best thing for people who are really interested in driving individually forward with projects at this point is to get in touch with me with something that piques their interest. And I can keep that process of moving forward. So certainly there are no gates or doors closed for leadership opportunities and potential for projects at this point. This is a fairly fast-moving and evolving space within the cluster, as it is with all the clusters in the support unit.
I see there's a question from Vidi. I was curious to know more about the citizen science project and whether the cluster and the project leads plan to engage patients, doctors, policymakers, and/or researchers in the design and implementation of this platform. Could you expand on this further? Thanks. Thank you for your interest in the project. As Erin has described, this is a cross-cluster project. So at this point, the data science and health informatics methods cluster is helping to design the portal from the infrastructure perspective. The knowledge translation and implementation science methods cluster is working together with, we do have patient partners on this project, we do have healthcare providers, we do have healthcare decision makers, we have a wide spectrum of stakeholders. We had a wonderful meeting in August to help to vision what this portal might look like. So indeed, yes, there is already activity underway and intent to continue our integrated knowledge translation in designing this portal. Would you like to add to that, Sterling or Erin?
Just to say that from the patient engagement point of view, one of the things that we've heard clearly on the basis of those consultations so far, that from that portal, patient representatives are really looking for a place to learn, to get their hands on good, credible, safe health information. They want us to create a space where they can contribute their own knowledge and shape research agendas. And they're also really prioritizing creating a space where there's a sense of belonging that feels like home, regardless of what identity you're recognizing or group identity you belong to. So creating a safe space that feels like home online for people to shape research and contribute data to help advance science will be our key key kind of tethers in terms of values in the PE methods cluster.
And next question, Carolyn asks, can you advise about how the in-development process works? So the in-development refers to the fact that as opposed to traditional undertakings of research processes or projects where it's competitive, where people submit proposals and then they're reviewed and ranked and the top ones move forward. This is a collaborative approach that we're taking in the methods clusters. So collaboratively, we've identified the themes and opportunities. Collaboratively, we've asked for leadership and for people who want to partake in the projects. And then the project proposals are worked on iteratively with the methods cluster lead, with the scientific director, and with the KT specialist. Once they reach that level of development, they're taken to what's called the Science Council, which is the leads of all the methods clusters. And they review those collectively to see if there's opportunities to strengthen them. And then after that, they're sent for review externally to experts in that area of methodology from outside BC. And we ask them for their opinions again in terms of how the project might be strengthened. Then it comes back again for internal review in the Science Council. And then once it's been through that entire project process, then the projects are launched. So it's quite a process. Do you wish to comment any further, Sterling?
No, I mean, I think that it's clearly a different process, and what we're trying to do is ensure that we have topics and then projects within topics that have got a high level of relevance in a BC context and clearly speak directly to the patient-oriented research methods agenda within the clusters. And we're trying to ensure that these are the highest quality projects we can have, which means that we're doing this iterative process. So they're going for external review, but the external review isn't a yes-no. It's not a summative review. It's more of a formative review where we're actually asking people, external experts, to help with the development of and the strengthening of the proposals that will then move forward.
And recognizing we've got 5 minutes left, I see a question here from Caroline. Can I check in then where all those who expressed an interest were connected with? Again, an excellent question. We've received amazing response. Over 60 people contacted us for interest in the project, in helping to be a part of teams and projects moving forward. Our intent was to connect with everyone. If people have submitted an interest and we haven't looped back, then please feel free to, and we encourage you to connect with us again. There has been, there's a lot of considerations in how these projects are pulled forward. And that has a lot to be based on criteria such as ensuring regional representation, potential budget, a number of other factors. Would you like to add, Erin?
Well, I'll reflect quite, frankly on the process of what that is like as a methods cluster lead, and that the opportunity, the privilege and the pain of being a methods cluster lead is that you do get the helicopter view of all of these moving parts that are happening in the BC support unit, not just in your cluster or in the methods, but across the gamut of this very sophisticated organization. And it's not, given that we had so many ideas potentially for projects, there's a process that happens, hours and hours of consideration around whether that project is something new whether there's another element in the BC support unit that is already being advanced that speaks to that. It might be from one of the other clusters. Some of the project ideas we had were more about the practice of patient engagement and not driving science more purely forward. And the take home from that was that there was some, there were decisions, and they're not, they were difficult decisions to make, but they were done from this helicopter viewpoint. And I think one of the difficulties in that is actually describing how that process occurs in a way that we need to, that's absolutely transparent and accountable. In that, we had probably, 50 or 60 different germs of project ideas, and there's, they were all laid out in Excel sheets. And it was like, okay, that one's happening in some way in another cluster. And so it was a very, very thoughtful process. And so I do want to share that a lot of time and thought went into that. But I'm happy to take any individual questions from anybody on the line or who's viewing this webinar afterwards, if there were bits of that you would like more direct feedback on or more kind of process-related information on. That's my job, right?
And I see a point from Bev. Bev is sharing with us, curious if you've seen the U.S. website Patients Like Me in reference to creating space or platform for aggregated information and data on patients, disease, research, etc. Absolutely, that was excellent point. That was one of the impetuses actually for the Citizen Science Project. And we're hoping to build on some of the components that make that successful, in addition to shaping it to address some of the things that platform does not do. So as Erin shared, there's a focus now on, rather than conditions, like a cardiac condition or a lung condition, that it's based on symptoms. Because typically patients go for symptom management for guidance rather than for a particular condition. So we're at 12:59. I think it's time that we wrap this up. So I thank you all for engaging with us today. But as has been stated previously, this again doesn't mean that it's over. So please feel free to continue to reach out with us and express interest in collaborating with any of the projects that were shared, and we're looking particularly for interest in the patient priority setting sub-theme. So thank you all.
Thanks very much.
Thanks.